Good afternoon.
Just like to give you a hard time.
The Health and Hospitals and Social Services Committee will now come to order. Today is Thursday, March 5th, and I detect a quorum. The first and only item on the agenda is Resolution 2020-217, Mendez-Hurd-Welsh, approves the employment contract for the Chief Medical Director of the Metro Government.
Move approval.
Second.
Thank you very much. I don't know.
Mr. Sharp is stuck in traffic, but he urges you to approve this.
Oh, absolutely. And I know that Dr. Caldwell has been attending some of the Minority Caucuses meetings, and he's very engaged, and I really think that he is compassionate and smart, and I think he's going to do a really good job. I think he'd be very effective in the job and making sure that we meet the needs of our people, and that I'm really, really happy about, to make sure that we have someone who has those character traits.
Chair, I wasn't able to make it, and I only watched the beginning of it, but I know that he spoke at the mayor's briefing this morning, and he spoke specifically about, I'm going to call it coronavirus. I know it has a more technical, better name.
Right.
But he spoke specifically about that, and I'm just curious, was anybody else able to see that, and what were your thoughts on him?
No, I was not able to see that, but I had been in contact with Mr. Sharp in terms of the plan that we had to address the issue itself, or the epidemic itself that we know that's in China. And I know that we did have one case that has been found in Williamson County. So I think that they want us to continue to do our usual things to avoid, washing our hands and, being careful and all of those things. What you say, Councilman?
Well, they had mentioned make sure that you're cleaning normal, high-traffic surfaces.
Right.
They found after testing surfaces that had been cleaned, it took care of it 87% of the time. The same thing with bathroom facilities, things like that. So it's just the basic stuff. Treat it like you're dealing with the flu.
Right.
Keep your hands clean. Try to keep surface areas as clean as possible. It's one of those things that we were talking about. Along with that, be mindful of when you go in the grocery store and you grab the cart. That's why they've got the little wipes for you. Same thing, have some in your vehicle, so when you go to the service station, one of the most high traffic areas is the gas pump. Nobody ever thinks about that, and so you got thousands of travelers constantly from everywhere. And if you can do those things, then it would work tremendously in our favor. Phones, yes. Touch screen.
Credit card machines.
Yep.
Well, I think just being cognizant of those things that we kind of take for granted most of the time.
That we share.
Yeah. Any other comments in regards to, we didn't say anything about, we hadn't voted on the directorship.
No, we haven't voted yet.
It has been properly moved and seconded.
Correct.
Any other questions, comments? All in favor?
Aye.
Any opposed? Good, thank you. I also wanted to just make a comment about the health and welfare of our city after the tornado. We've got quite a few people who are disabled, who are without power, who don't have medicines or can't get access to their medicines. So just want you all to be thoughtful of them. And if you see people on the street who seems to be lost, stop and ask if they have any needs that we might be able to assist with them, because I think it's the time for all of us to just come together and do as much as we possibly can for one another.
And real quick, along with that, one of the things that we mentioned this morning, and I was doing it via phone because I couldn't make the presser this morning, but being cognizant of, on the senior component and just in terms of overall community health, one of the things that we've already run into is you have so many seniors who typically are on some type of list that says, if the power's out in this area, check on this home because we provide oxygen to those homes. And so we were finding that we were running into that, and we sent ambulances a few places today to check on seniors. But that was because information was coming in saying, what do I do? I have a neighbor or a mom or somebody that's in that situation. So we need to try to be cognizant of that component. I think, and I haven't had a chance to check, that may have been some of the calls that, emergency calls that come in, but you have a lot of people with respiratory issues who are on oxygen, who require power, and so we need to make sure that we're on top of that.
To that end, is there, when we look at emergency preparedness, right? I mean, we don't have these types of disasters often, but when we look at that, and we all have plans, right? Every department has a plan. Are there things that the plan needs to be revised of, I guess, from the administration that's a question for. So, are there things that didn't work like this that could be improved in the future?
I think so. I think it should be. I actually think that we should probably have designated places for specific things. Because when you're talking about medicines and dealing with things, you go to one place for that. You go to another place for foods and things. I think we need to have something, especially in a case like this, some mental health counseling available to people. I think I need some myself.
Trauma is involved.
Because it really, really is.
And there are lines out there. I think that's the question that I have is, what have we learned from this, and is it an administration policy change to create better emergency preparedness plans, or is that something we need to legislate?
I don't know.
I really think, in particular,
discussions.
what's worked well so far this term, I think as council members, each of us should urge the vice mayor, the next round of temporary committees that we set up, there should be a focus on emergency preparedness so that we can delve into this and look at how we can strategically be prepared and place those things better in each individual community.
Having worked in an organization who goes through emergency preparedness drills and policies, it's a little early to debrief what's going on because we're still in the throes of it. But I can tell you that the state, the federal government, and the city work together on these kinds of things, and we've been through enough disasters here with the 98 tornado and with the 2010 flood that there absolutely is an emergency preparedness plan in place, and there absolutely will be a debrief afterwards to do the very things that you bring up to learn, because we can never be 100% fully prepared and expect what we have. But
Right.
I promise you, there's a plan in place to deal with these kinds of things.
It is. I remember working on one some years ago. I was a volunteer at the American Red Cross, and it is, and it all does require. But just think about it, it's been 10 years since the flood. It doesn't seem like it, but it's been 10 years. And as you know, we were at OEM, and Mr. Jenkins from NES said that there were only 200 trees that were poles that were knocked down, and this time it's 600.
Way over
And
that.
now, he said 600 yesterday, but today I think I saw an email where it's like 732 or something to that effect. And so they're still finding those poles that are down. So it's just hard, and I just think what we might need to do is make some notes to make sure that we can add those things that we find that have been
Sure.
a problem.
All of that will be a part of a pretty massive debriefing process, I'm sure of. But I also want to note that, I've been pretty amazed at some of the things that I've seen from Public Works and NES as well. We're getting exceptional updates from NES that we can pass on to our constituents, which is really helpful to them. And to be able to accomplish what they've accomplished so far has been pretty amazing to me.
I would also like to add, I completely agree with you. I think that the city has done a great job, but I'm completely blown away at the grassroots efforts of our council members and our state legislators and our community leaders and activists that have just mobilized and come together and taken care of the city as a whole, especially communities that are marginalized communities are being taken care of and looked at. And I appreciate the fact that everybody has been all hands on deck around the clock getting people taken care of. One quick suggestion I would like to make, and I know I agree it is early to debrief, but while it's on my mind so that we can kind of make sure to come back to that conversation, I think that it'll be a good idea for every council member to identify like 1 to 2 emergency locations in their district, and then we can have some type of emergency plan where if this is a level 1 emergency, these are our locations. If it's level 2, we add these locations. If it's level 3, we add these locations. That way we're not scrambling trying to figure out, are we going to be at McGruder or Lee Chapel or Hull Jackson? We will know for level 1 emergency, this is our triage station. For level 2, we have both of these locations.
That's
And
exactly
based
what I was
on
thinking
their
about.
statements,
Yeah.
one of the things, unfortunately, we weren't hit really hard, but having a post-2010 flood, having gone through that process every year with the Red Cross, they will come in and train up, help you designate locations for those different things. So we were able, luckily, not to have the need, but have staging areas, right, where we know we can drop supplies or heavy equipment. Another one where we know it's better suited proximity-wise to fire stations, so that would be medical. And then near other places that had storage capability or prepared to do a pantry or food. So it's very much possible, and the Red Cross can actually help definitely with each council member with that, because we didn't need it, thank goodness, but we did have those in place.
Yes.
And I brought up the topic just from and I didn't even think about, we are still in the throes of it, but I do think it's important that all of us are focused on this. Obviously, we're all focused on it because it's our city, it's our people, it's our constituents. We are Nashville, but it also is important for us as leaders to be thinking about these things. And of course, in thinking about trauma centers, what still has power? So how do we have backup when an area is wiped out, or that's the church that got leveled? Like,
Absolutely.
what if Hobson Church was the one in that area and it's gone now? So I think that there is a lot of thoughtfulness in that, but to some degree public safety is what I was just hearing you. And so the overlap, and that's where I think I'm going to stop, because I feel like we're talking about it, we all get it, and yes, there's room for improvement, but we also don't even know what's gone wrong at this point.
So I thank you for the spirited discussion, and I agree wholeheartedly with everything that has been said, and appreciate the efforts from all. Mr. Sharp has joined us.
Mr. Sharp.
I left Litz at 4:15. Madam Chairman, sorry for the interruption, but Dr. Gilwright, who's the Chief Medical Officer today, at least until Monday.
Will be till Monday.
And came here, and in case that anybody had any coronavirus questions, if y'all would like, anything you'd like to know, he's the man to talk to.
Well, we kind of briefly talked about it. Did you want to add something to the conversation?
No, you pretty well covered, we're not in any emergent situation. This is something we deal with on a routine basis. Good points on all of those things to think about as far as washing hands, the things you touch, cleaning those. If somebody's ill, trying to stay back about 6 feet. We need to all learn new manners as far as instead of shaking hands, probably a neat elbow bump or something else, so we're not touching hands that have touched something else.
Not kissing.
No, no kissing at all. Yeah.
Kissing.
But all of those common sense things, we're going to see some more cases probably, but what we've got right now is somebody that was exposed overseas and is back. They're being monitored. They're self-isolating, and so I think that calm and collected is the approach. We are rolling out a lot of different things. Our website at the health department, putting more and more things up, kind of trying to simplify some of the things that the CDC is putting out, because their statements are a lot of times 3 and 4 pages. We're trying to make them into a 1-page statement we've got one up already for businesses about cleaning surfaces and how to keep themselves safe from infection, that type of thing. So we'll be rolling more of that out. So
Quick question. I'm sorry, Madam Chair, may I ask a question? If someone is traveling, do they need to wear a mask on the plane?
Masks are not helpful for those that do not have the virus.
Okay.
And the reason for that is most of us don't wear them correctly.
Okay.
The ones that, if you can get them, the round ones are better, but most of them are leaky, so air gets in around that. The other thing that happens is it gives you a false sense of security, and because you're not used to wearing them, most people touch their face more. Your mouth, your nose, your eyes are where that virus gets in. If you're touching your face more, you're actually more likely to contract the virus.
If you're sick, on the other hand.
When you're sick and you're afraid of sharing it, then yes, so that it keeps you from coughing and spreading particles out and about, then definitely.
Thank you.
Sure.
So I just would note, Mr. Sharp, that Mr. Overlock did a very poor Tom Sharp imitation prior to your arrival here, so we're
I'm
really
not
glad that
surprised
you're
in the
able to
least.
supplement that.
I thought it was middling. No, it was poor.
I would say more on the poor side.
Tough grader.
So that coming from the D student.
Even that low bar has not been.
Well, thank you all again so much. That's it for our meeting. I have a motion to adjourn.
To adjourn.